Good morning, Sergeant Stephen.
Good morning, sir. How are you?
I'm doing well. How are you?
Good.
Perfect. All right, so I just evaluated this male. His name is Captain McCotlong. You're going to be working with him for the next 4 weeks. I just diagnosed him with lateral epicondylitis. So I pretty much created a treatment plan for you that you're going to be utilizing for your next few sessions. One of the things that I want you to note is that you're going to be applying some kinesio tape with him towards the end of his session. He stated that kinesio tape help alleviate his pain. So this is one of the modalities that I want to incorporate for my treatment plan. Okay. Have you ever applied a kinesio tape before?
No, sir, I haven't.
Oh, perfect. All right. So I'm gonna teach you how to apply lateral epicondylitis. Kinesio tape for a lateral epicondylitis. Okay. All right. Perfect. All right, Sergeant Stephen, here's our kinesio tape. Do you mind if I have your forearm elbow? All right, so if you don't remember what lateral epicondylitis is, it's the inflammation of the common extensor tendon, which is located right over here. Typically, some of our clients that get lateral epicondylitis, they get it from repetitive motion and movement of their forearm muscles, specifically under extensor muscle belly, okay? Captain McCotlong is a pilot, so typically he uses his forearm a lot to control his helicopter and whatnot. Okay, so here's a kinesio tape. This is one of the modalities that we use. So typically how I would apply this is I would typically measure the size of their extensor rod, like from here on the common extensor tendon side, and then right about like halfway through the forearm, okay? So one of the things that I want you to keep in mind though when applying this is to ask them first if they have any allergies with any adhesive material such as tape, all right? Perfect. All right, so I'm gonna measure this real quick. So right around here, I'm gonna cut that small piece. Typically what I like to do is round it out a little bit, okay? Make sure just cut each edges, so in that way, if it gets caught on something, it's not gonna come off easily, okay? Okay. That's perfect. So it's a little bit small because we're gonna be stretching it later on, so, okay?
All right.
All right, so from here, this is about size. You can cut right in the middle till about, you get about 1/4 towards the very end, so. Right here is perfect, okay? And then go ahead, cut and round the edges. Perfect. All right. So this is gonna be your anchor point, which you're gonna be sticking right over here, about like right on halfway through the forearm, okay? And then from there, show you. Right over here, and I would usually rub it just to cause some friction and make sure it sticks, okay?
Okay.
So from here, there's usually different stretches that you're supposed to do when applying kinesio taping, okay? So I will take the strip and then I will bring it like right about 1/4 towards the very tip of this kinesio tape. So from here, there's different types of stretches that you're supposed to do. So typically, when you pull this is about 100%, 50%, and about less than 50%. So it's about like 20 to 30%, okay?
Okay.
This is the amount of traction that I want you to pull, okay?
Okay.
All right, so from here, you're just gonna wrap it around. You're gonna make kind of like a circle, and then try to get that area on the extensor one. All right, and then same thing too on the other one. So just pull it here, about 1/4 towards the very tip, 100%, 50%, about 20%, Now we'll just go around. Perfect. Now we'll just rub it. So now it sticks better. All right. So from here, how you feel?
I feel good.
All right. So from here, I want you to just extend your wrist and then extend it up. Perfect. Does that help alleviate? You're gonna ask him if it alleviates his pain or if it doesn't. Okay.
Okay.
How do you feel though?
I feel good.
Perfect. All right. So one of the things, some of the precautions that I want you to ask him is, that I want you to note and also tell him is to just be aware of any reaction to the adhesive material of this tape. So just check for any redness or any kind of allergic reaction. And if he does experience any of those, just have him take it off and then just come to us, and then we'll alter whatever modality or plan of care that we have with him. Okay?
All right.
And then other than that, you can also tell him he can keep it for the next 2 to 3 days, and he can also shower with this material as well.
Okay.
All right. All right. So now at this time, now that I demonstrated to you how to apply a kinesio tape on lateral epicondylitis, I want you to perform a verbal teach back on me on the process of what I just taught you.
All right,
Sounds
sir.
good?
Sounds good.
All right.
So to begin, kinesio taping, I want to make sure I explain it to the patient. It's basically a modality we use. For you specifically, we'll be doing it at the end of the treatment plan.
Mm-hmm.
And this will basically just consist of us placing this tape on you. Something to be aware of is the tape sticks via an adhesive. And if you have any sort of allergic reactions to adhesive tape or adhesive additives, just let us know, because this could potentially irritate the skin.
Perfect.
If the client doesn't have any allergies, then I'll go ahead, measure out the kinesio tape, cut it, make sure I round the edges. I'll find the lateral epicondyle of the client.
Yep.
So for you right here, and then I will go ahead and apply the kinesio tape, making sure I kind of create this ovate egg shape near the extensor tendon region.
Okay.
After that, I'll brief the client saying, make sure that you can wear, or that you're able to wear the kinesio tape for up to 2 to 3 days. After that, we'll provide you an extra piece of tape so you could apply the tape yourself if you want to.
Okay.
If not, we'll go ahead and apply it at the end of each treatment session that we do here in the OT clinic.
Perfect. All right, I just have one question. So after you anchor the kinesio tape, you said you're gonna wrap it around, right? What's the percentage of stretch that you're supposed to apply here?
Sir, I believe you said 25.
Perfect. Awesome. Yeah, that is exactly how I want you to do it. All right, seems like you're ready to apply it to the patient. You ready?
Yes, sir. All right, good morning, sir. Captain McCollum, I am Sergeant Stevenik.
How's it going, Sergeant?
Good. This is my supervising OT.
Okay.
And today, so we'll be applying some kinesio tape for you. Before we do this, do you have any sort of allergic reactions to adhesive?
Not that I'm aware of.
Okay.
Yeah.
So we apply this tape. It's a modality that we use at the end of our treatment session, and it basically is to help alleviate some of the inflammation on your lateral outside part of your forearm.
Okay.
So if you could place the forearm that hurts on the table. And all right, sir, so I'm gonna measure out this tape. Around the edges. And this just helps to make sure that it doesn't get caught on any sort of clothing. Next, I cut it in half, right down about a quarter, and I round the edges. All right, so this area right here is about where the pain is, huh?
Yeah.
Okay. All right, so I'm gonna go just below, and I'm gonna apply the anchor point. So here, no stretch. But I want to make sure that this is pretty rubbed on, so apply a little bit of friction to heat up the adhesive. Next. Get one of these straps, and so here's about 100, here's 50, here's about 20, and I'm gonna go ahead and wrap that around in almost like an oval shape. Same thing on this side. So I pull up to about 100, 50, 20, and I apply this in an oval shape. All right, sir. So
good.
how does that feel?
Good.
Good?
Looks good.
If you can, go ahead, do a few wrist bumps for me. Does that help with the pain at all?
Yeah, it alleviates the pain a little bit.
All right. So we'll go ahead, you'll get out of here, and just for some wear tips, you can wear this for 2 to 3 days. You can shower with it. We're gonna give you an extra piece of tape. So if after those 3 days, if you wanna reapply it yourself, you can. There's videos on YouTube that instruct the same thing that I just did. If not, make sure after each treatment session, you're gonna come in and we're gonna do this for you, just to help with some of the inflammation.
Okay, sounds good, sir.
All right, so do you have any questions?
No, not at this moment. Thank you.
In this scenario, we use the teach-back method. Now, how effective is a teach-back method? Health literacy experts support the use of teach-back. It is an evidence-based method used during conversations between healthcare workers and clients, as it can improve recall, understanding, and adherence to treatment plans. Teach-back is also recommended by the Joint Commission, as it is the #1 ranked health literacy practice to teach trainees. There is a growing body of evidence that supports the effectiveness of teach-back. It is associated with increased knowledge, better adherence to medical regimens, improved patient outcomes, and improved patient safety. Other advantages of the teach-back method is it is effective for learning in the psychomotor domain. It also actively engages the learner through stimulation of visual, auditory, and tactile senses. In this scenario, Sergeant Sebenik explained how to put on the kinesio tape for lateral epicondylitis, and he also performed it to the patient. That muscle memory starts forming with each repetition. Repetition of movement and constant reinforcement increase confidence, competence, and skill retention of Sergeant Sebenik. It also provides the opportunity for overlearning to achieve the goal, and this is why we use the teach-back method.